Welcome to The Explainer. Today, we're looking at an absolutely fascinating intersection of psychology and personalized medicine. A recent series of studies has unveiled a significant, undeniable association between a specific personality trait and how our bodies physically process prescription drugs. Now, if you've ever felt like the standard rules of medicine just don't quite apply to you, well, this data might actually explain why. Okay, let's dive into this. Do you, or maybe someone you know, react unusually strongly to medications? Think about it for a second. Have you ever been prescribed a totally standard dose of a common drug, only to feel just completely overwhelmed by side effects? Or felt like the medication hit your system way harder than your doctor anticipated? For a really long time, patients who reported these intense reactions were kind of left confused, or honestly just dismissed. But as we're about to see, science is finally catching up to this exact experience.
Section 1. The highly sensitive person.
So, in the scientific literature, a highly sensitive person, or HSP, possesses a trait known as sensory processing sensitivity. This is a temperament trait characterized by a heightened reactivity to environmental stimuli. Essentially, it means their nervous system is naturally dialed up. They process information and physical sensations much more deeply and intensely than the average person. And this brilliantly illustrates just how common this trait actually is. Being a highly sensitive person isn't some rare anomaly, you know? According to the research, this temperament is found in roughly 20 to 30% of the general population. To put that into perspective, that is 1 in 4 people walking around with a highly reactive nervous system. Section 2. The medication connection. The data we are exploring today comes from a recent January 2024 publication in Frontiers in Psychology. It was led by an international team of researchers out of Stony Brook University, headed up by Dr. Arthur Aaron. Now, to truly trust a medical discovery, we have to look at the methodology. And these researchers didn't just ask a few people a couple of questions. No, they ran 3 distinct studies to ensure the findings were incredibly robust and repeatable. They pulled from really diverse participant groups across ages and genders, mixing university samples with online platforms. Plus, they used strict, validated measurement scales to assess both sensitivity and emotionality. So the crucial point is summarized perfectly right here in the findings. Individuals high in SPS report heightened sensitivity to medication compared to individuals with lower sensory processing sensitivity. They established a direct biological link. Basically, if you score high for sensory processing sensitivity, your body is significantly more likely to have a heightened, intense physical reaction to prescription drugs. Section 3. Debunking old assumptions. In the past, when patients complained about high medication sensitivity, doctors commonly linked it to something called negative emotionality. The assumption was basically that these patients were just anxious, prone to negative emotions, or maybe overly stressed, and that was causing the perceived side effects. But this new research definitively proves that the relationship between high sensitivity and medication reaction exists independently of negative emotionality. It is a valid biological reality, not just an anxious attitude. Another really important finding from the data is that this link remains exactly the same for both men and women. This thoroughly debunks those tired old stereotypes about sensitivity or emotionality being skewed toward one gender. It's a universal human trait affecting male and female nervous systems in the exact same way when it comes to processing medications. Section 4. The future of medicine. This brings us to a real game changer, the concept of personalized and precision medicine, or PPM. You see, we're rapidly moving away from the era of one-size-fits-all healthcare. PPM is a much more nuanced approach. It's all about tailoring targeted and effective treatment strategies directly to a patient's individual treats. And Dr. Aaron's research fits perfectly into this new era. These discoveries literally pave the way for doctors to create highly customized treatment plans for that 20 to 30% of the population that is highly sensitive. So here's how this knowledge can actually be applied in clinical settings. First, it impacts the ideal medication dosage. If a patient is highly sensitive, doctors might need to start them on a much lower baseline than a non-sensitive patient. Second, it helps accurately measure overall medication effectiveness, separating the drug's actual work from the nervous system's overreaction to the stimuli. And third, it's all about monitoring and preventing adverse drug reactions before they happen by identifying highly sensitive patients up front. Which leads us to the ultimate goal highlighted by the research team: Beyond just understanding the psychology, they noted that the HSP scale exhibits really promising potential for screening all patients. Imagine a world where taking a simple, highly sensitive person questionnaire is a totally standard part of your medical intake, right alongside checking your blood pressure or asking about your family history. Screening for this trait universally could drastically enhance patient safety and overall care. So I want to leave you with this provocative thought as we wrap up the explainer today. If a simple questionnaire could prevent your next adverse drug reaction, how will your future doctor's visits change? We are standing right on the edge of a major shift in personalized healthcare, where understanding your unique temperament could be the exact key to unlocking the safest, most effective medical treatments for you. It's a fascinating step forward for science, and honestly, a huge validating moment for highly sensitive people everywhere.